We have also extended NHIS coverage.
This is the Vice President, Dr. Mahamudu Bawumia, confirming over 61% increase in NHIS registration numbers since 2017. But do these numbers mean anything at all, especially with the level of quality of services being provided in various hospitals across the country? Outside of the imposing gates of the Accident and Emergency Unit of the Komfo-Anokye Teaching Hospital and the waiting room of the KNUST Hospital, a restless crowd gather with their faces imprinted with worry and desperation. These are not just visitors earnestly waiting for good news concerning their sick relatives, but patients and family members perturbed with medical bills they cannot foot. Gifty Boache almost shed a tear talking about her sick mother. She has spent days at the hospital, banking hopes on the National Health Insurance Scheme, which she describes as stale.
Insurance and say we scapa now bibi yale and now bibi wa and one is what that wo me ba happen and be hu say and yet him sa Ghana yedin woni bi pa woni say woni bi a bibi wa no say wo.
The scheme has become stale. Now, if you do not have money, you won't receive quality health care. Why? We have to pay for almost all the services received.
Oh, yes, so bad, the Mawania, the Mau boom. Oh, baby, I a cotolet, a jiska, baby, I Unco Senior Maya jiska. Just a bibia, oh, packet or car cry a jihuska. Oh, Yalena, ya dini pana bana packet kaka, ya jihuska. A broso.
There have been several complaints about the quality of NHIS service provided by some health facilities across the Ashanti region. Some individuals are reporting long delays in receiving treatment due to not having a health insurance card. They disclose instances of lack of essential medication due to inadequate coverage of expenses. These required subscribers to purchase medicines that they expected should be covered under the scheme.
Look at
the number of drugs they have prescribed for me. Why would we be buying all sorts of drugs if it's working?
Oh yeah, Juma. I do you free now. Lasso, we register there. Oh, more yamo. Lasso, no best animal now. Oh, yamo. Kato drew.
They took 20 cedis before giving me a bed in the ward here in Kumasi South Hospital.
Bed no 20 Ghana cedis without receipt. They to me, when they cover me, be same mamma in the area. And I be the neighbor has a much as beautiful Dunquao, and a bassy, a buyer, almost a paniho, and pass short. Must I make it's not, and a Bahama number 6 o'clock. A bonaju, 1 o'clock, and Pama, Mammy, Albadaso, a look rampono, a Tiesca.
I brought my mother, but we had to pay a bribe of 100 Ghana cedis before getting a bed. I have bought all sorts of drugs for 2,000 Ghana cedis.
I don't say to me, Bassa. Health insurance, and yes, I said, and no, which your man in Nigeria, and yet more has he. Health insurance, necessary yet more has he. But you know, to do almost 50 Monday in payment, but to do a couple of 2,000.
For these aggrieved individuals, the struggling National Health Insurance Scheme is not just a health administrative obstacle, but a point of evidence of poor health systems and the inflicting reality of the poor. This is Samuel Tay Wayu.
A draw nibo and yeten and a health insurance a cover. And a beer card. I said, draw any boy didn't say beer.
The ones that are given free are not expensive, but the expensive ones I have to buy. This is my card, and I don't see any need.
You see, I'm about near cover crown. This is a movie anyway. Or much or drama may be 7 cotton. I in your capital over 33,000. You know about Kuninamu, health insurance to be uncovered.
According to the 2023 medicine list of the National Health Insurance, appraised by a specialist group, the currently reviewed medicines list contains a total of 548 formulations. Childhood immunizations, tuberculosis, HIV/AIDS, and mental health care are exempted from the scheme. The document disclosed that executive management of the NHIS has directed and approved a 20% increase in the prices of medicines as a stopgap measure to mitigate the recent increases in prices of medicines on the open market. A health official who pleaded anonymity explains the hospitals are compelled to top up prices of drugs and medical consumables due to price disparities in the open market price and the bench price covered by the NHIS. The situation seemingly grants profit-seeking hospitals a chance to charge patients more than required as top-ups.
Insurance has its own pricing for each drug. If that is not the price that the hospital gets on the market, that means the patient has to pay for the extra amount. Because insurance price is usually so low that you go to the market for the equipment that you need for the procedure, and it will be way above the price the insurance is going to pay. So you have to add the difference for the patient to pay. And some hospitals actually add extra for profits.
He further disclosed underfunding of several hospitals and bureaucratic hurdles of NHIS medicine administering guidelines are engulfing several facilities.
When they list the drugs, it means you have to stick to what they've said. Insurance sometimes they will reject it entirely and flag it as wrong, so they won't pay because they have specific treatment guides that you have to follow. If you go out of that, they have so many rules, so the hospitals would have to find ways and means to make up for all of that. Insurance is a stickler for rules.
Efforts to reach the Ashanti Regional Health Insurance Office have proven unsuccessful, but health officials are proposing an increase in premium drugs covered by the NHIS.
I believe funds to facilities should be released on time for them to be able to get the needed consumables for work. I also think that premium should be increased for especially those who can afford, those in the formal sector whose deductions are made straight from their SNP contributions.
Universal health coverage in Ghana says that all persons should and must receive timely access to health care. It is then apparent that a national entity such as the National Health Insurance accrues some attention to the struggling portions in order to improve service and ensure that we achieve the universal health coverage targets. Reporting for Joy News, my name is Clinton Yeboah.